information line effective 9 a.m. this morning. That line will run until 5 p.m. this evening. It will continue to operate Monday through Friday until further notice. The phone number for the Citizens Information Line is 843-746-3900. For our Spanish-speaking community, that phone number is 843-746-3909. Charleston County government will continue operations to the extent possible, and those operations include curbside recycling, landfill operations, and all county convenience centers will remain open. There will be no new eviction putouts or notices provided during this period, and citizens are encouraged within Charleston County to utilize online pay services to pay their taxes and other fees within Charleston County. So at this time, I would like to turn the press conference over to Charleston County Chairman, Mr. Elliott Summey.
Thank you, Jason. Thank you for all for being here in these times, whether it's hurricanes, floods, or now with pandemics. Our media partners are as important as ever. If we're going to get information out real time to our folks, we have to rely on you folks to help us, and we appreciate our media and news partners for all you do. Not only are we and our citizens out here and our employees out here on the front lines, y'all are out here with us, and I want to thank you at this time for continuing to help us get the word out. Also, I'd like to thank all the elected officials here from state, local, school district folks here to join us. This is a message of solidarity. We're here working together as one voice, as we always do, here in Charleston, Tri-County area, with Dorchester County and Berkeley as well, to help protect and provide for the safety and welfare of all of our citizens in the Tri-County area. As Jason said, we are continuing with our garbage collections. We're supporting our municipal partners as they collect our garbage, bringing it to the county landfill and our recycling program. We are in a health issue. Sanitation is a must at this time, so we're going to continue to provide those services as much as possible. Charleston County government is going to continue to function in some way or shape or form. We don't know what all that means right now. As time goes on, maybe we have to close buildings to the public, maybe we don't. Right now, we're going to use every technological and common sense approach possible in order to keep the functions of county government open. As y'all are well aware, when the school district closes, generally speaking, during hurricanes and snow events, county government shuts with it, because we have a large number of our employees who have school-age children who need to be supervised at home by their parents. We are working remotely where we can. If we've got parents who need to be home with their children, we are working electronically from home. If we have citizens or employees, over the age of 60 or who have immune issues, we are providing them to be able to work from home without penalty as well. We are doing everything we can to make sure that our folks remain whole and continue with county government as best possible. We have a lot of electronic and virtual resources at our capabilities here in the county, some of which we've been doing for a long time, some of which is new. We have an EMD app, so if you go to your Apple or Google Play Store, you can go search Charleston County EMD. It's a free app. You can put the push notifications on, so any alerts that come out of EMD will come straight to your cell phone. That's something we've used over the last few years through hurricanes, and it's worked well. Also, social media is a big deal for us. Facebook, Instagram, Twitter. Charleston County government and Charleston County EMD have social media capabilities, and we're going to continue to push messages out that way. We're getting a lot of requests and talk from our hospitality community, our restaurant communities. We are in conversations with the governor's office about those capabilities. Right now, we're waiting and talking constantly with our state partners in that regard. However, at this time, I can say that Charleston County government has made a request of the municipalities and the Department of Revenue and the Governor's Office to suspend and defer the accommodations tax payments and hospitality tax payments that are due at the end of this week in order to help mitigate the issues with our restaurants and our hotels in order to keep cash flow in the community for their employees. And in the event when things start really kicking back off again, their reopenings. We are not foregoing them. We're just deferring them for at least 90 days at this point, not knowing how long this is going to take. I think what most folks need to understand is your county government is here to help you. We're here to work hard to keep our citizens safe, whether it's our sheriff's office, our EMS, our fire, all of our folks, treasurer's office, all our tax collection folks, our sanitation, public works. We're going to continue to work hard to keep this government going. We're here to help. Call that Citizens Advisory Line. It's very important. If you have questions, do not call it if you have a medical emergency. Again, if you think that you have an issue with this coronavirus situation, go to MUSC virtual, the virtual website, go to the medical university, contact DHEC, and of course, if you have any other emergency type situations, always dial 911 for our consolidated dispatch system. That Citizens Advisory Line is to answer questions other than medical emergency questions. At this time, we will turn it over to Mayor Summey. Mr. Mayor.
Thank you, Mr. Chairman. We are here as a group of the municipalities working with the county to make sure that we're all singing off the same page when we leave, that we're working together to make sure that all rules and all regulations that are enforced in every location. And that's important. We will follow exactly what the federal government and the state government passes down for us to do. And we will move forward. We are at full service in our police agency and our fire agency. We're just like any other day. Our offices have been cut back, the services within our offices, although we still can get a building permit, you still can come in and put your plans in so they can be studied while this is going on. It might not be as fast as normal because a number of those people who work in those departments are not there, but the services are still being provided. The utmost concern that we have is the safety of all of our people, and that's what we're working to do together, collaboratively, coming up with decisions that make it work. However, whatever the federal and the state government orders, we have to follow those guidelines. And so we will be implementing those things as they come forward to us. I just want to thank all the other local governments that are involved here for the willingness to work together and come together to provide the best level of service that we can in the safest manner to all the citizens of this great county and this great state.
Thank you, Mr. Mayor. Mayor Tecklenburg?
Did you have something you wanted to interject?
No, it's okay.
Okay. Thank you.
Yes, sir.
Practicing social distancing. So you need to move the camera back and forth to get a panorama here, but I just want to reiterate the unity of our local government with the sole purpose of protecting the health and welfare of our citizens and our employees as well, because we as government need to continue to provide those essential services as we go forward, no matter what happens. And I mentioned yesterday, this is a very fluid situation. I mean, just by the time that the city of Charleston had voted and approved an ordinance that restricted gatherings of more than 50 people, just an hour or two later, the Center for Disease Control now makes a recommendation to limit it to 10. And so, and the governor has an announcement this afternoon. The president today is empowering governors across the nation to be more restrictive. And so I think in the next few days, the public's going to see an increasing restrictions, if you will, awareness of promoting social distancing and being mindful of gatherings with other folks so that we don't spread this virus. And so that's the whole thing about where Charleston is right now. We do not want to become a hot spot. And as Dr. Cole says, we need to do everything that we can to flatten the curve. Sheriff Cannon was just quoting what's been going on in Italy over the last couple of weeks. We want to, at all costs, avoid becoming the next Italy here in South Carolina. And we do that by reducing the exposure and reducing the chance of contagion of the virus amongst the general population. That's just the bottom line. And so that comes with some inconveniences for everyone. It will come with economic loss, particularly for small businesses, that we will put forward loans and other programs to try to help those businesses and their employees as well. But the bottom line is we're all in this together. And if we can keep Charleston from becoming a hot spot, if we can prevent that, it would be some short-term pain, but the long-term gain will be great because we really will be more resilient and our economy will bounce back faster. So we just implore all of our citizens to be mindful of these practices. Some of them are very simple, but the most important ones that we're talking about yesterday, today, and probably the next couple of days is restricting exposure to groups of folks that, again, might be able to pass this virus from one to another. So I don't know who's next on the list.
Mayor Haney.
But Mayor Haney's up next. Thank you.
Mr. Mayor.
Thank you. Good afternoon. Mount Pleasant is at OpCon 2, and we're under a civil emergency proclamation that went out about noon yesterday. So we're operating under those conditions. If you have questions about what's going on in Mount Pleasant, you can go to our webpage, which is www.tompsc.com. That's Town of Mount Pleasant SC.com. We're operating with two priority objectives. First is the continuity of critical services, which includes law enforcement, fire, and sanitation. And second, to limit exposure to staff and to our community. This protects our critical healthcare infrastructure. I want to say again, we are not necessarily experts, none of us here, at managing contagion among tens of thousands of people. But we are good as a town at keeping our operational functions going. We do not need to have a significant number of our first responders being quarantined or, God forbid, testing positive for this disease. We are limiting exposure to the community through the state of emergency and by limiting large gatherings. We've positioned ourselves to be proactive, but we understand that this is a fluid situation and we are responsive to changes as they come. We're thankful for the patience and flexibility of our citizens, and we are going to be instituting programs to sustain businesses through this and to also provide recovery when this is over, and it will be over at some point. I'm really thankful for the coordination and the cooperation we have here. You've seen us here before, whether it was storms or bridge crises or a snow event. We never thought we would see this, but it is good to know that this teamwork and this communication continues even under these most unusual circumstances. We may question whether we have done too much, but God help us if we do too little, because we will evaluate these actions by two things, either dollars lost or lives lost, and for me, that decision is clear.
Thank you, Mr. Mayor. At this time, I would like to bring up Chairman Bailey from Dorchester County.
Thank you, Mr. Chairman.
Yes, sir.
I want to ask the people in Dorchester County, if they will, to get a piece of paper and pencil out, because I'm going to give you some important information as I go on. And I want to, first of all, encourage everybody to watch the President's remarks at 3 and the Governor's remarks at 4, because with these people, they're more, I won't say they're more knowledgeable, but I want you to listen to what they're saying, and I'm going to ask you to do what they say to do. Dorchester County, last night, we went into a state of emergency, and it will go on until April 13th. The emergency operation is the same as Charleston. We are OpCon 2. County offices remain open, but are closed to the public until further notice. The officers are available by phone and email. I'm going to give that to you in a minute. Residents and businesses are encouraged to go and use online service. Dorchester County Courthouse and convenience sites will stay open. convenience fees for online services have been waived through March the 31st of this year. A full list of closure, including offices and community facilities, is available on the Dorchester County website, www.dorchestercounty, excuse me, let me get it right, Dorchester, got to go down here where I can see, Dorchester County SC COVID-19. Public safety agencies are working together, as you heard, to provide appropriate service through 911 involving an illness and reduce exposure. We've been working very closely with our DHEC, our hospitals, our emergency management. Protecting the public is all of our number one concern, and that's important. We ask that you continue the exercise, patience, and understanding during these changing times, and look for one another and help one another in need. We're going to get through this period, but it's going to take us all working together as a community. All updates will be available at www.dorchestercountysc.gov/COVID-19. It's going to take us all together, working as a team, to get over this, and we will get over this. At this time, as about 1 o'clock, I've been told that we have no case in Dorchester County with coronavirus, but I'm sure it's coming. Again, thank you, gentlemen, for including me.
Yes, sir.
Listen to what the governor says and the president.
Thank you.
Thanks.
Yes, sir. At this time, I'll ask Mr. Representative Gilliard, 61.
Yeah, first of all, I want to thank both mayors on what they're doing to help us with this much needed, important situation that, we're dealing with this coronavirus. In your efforts, it won't go unnoted. Now, ladies and gentlemen, let me give you a brief update on the state level. I've just been informed that the State Finance Committee has just met, and the full Senate committee will meet at 2 o'clock. Now, the State Finance Committee, the Senate Committee, has approved $40+ million for this effort as it pertains to the coronavirus. As you well know, we're being called back in session on Thursday in hope, in anticipating that we would have a bill to vote on, to approve, to get to the governor's desk, to make the $40+ million, which would be keeping our DHEC department viable under these serious circumstances that we're under. I want to say this, because this is very important. I just met with Councilmember Jerome Hayward, Councilmember Michael Brown, and a couple of Pastor Brown, our church leaders. As of today, we're asking everybody to remember the homeless population as we go through these trying times. As you well know, we have over 500,000 homeless people in this great country we call the United States of America. In the state alone, here in South Carolina, there are 5,000+ homeless people at any given time. Out of that 5,000, there are 400+ veterans that are homeless here in the state of South Carolina. So we just want to put everybody on notice as you have dialogue, as we go through these trying times, that remember the homeless population. Because think about it, as we try to conquer this, and we will do that. If one homeless person is left out that has contracted this virus, then we're spinning our wheels. Because that one homeless person will venture out into the tent cities. And we do have them here in the state of South Carolina, okay? Right here in Charleston, in North Charleston. We got to be real about it if we're going to be inclusive. And we have to include the homeless people. It's our moral right to do that. But we have yet to have heard, whether it's from the president on down, about what we're going to do with the homeless population. So I just want to put everybody on notice. Keep them in your prayers. Thank you.
Thank you, Representative. And we appreciate everything that the legislature is doing for us. The $40 million is going to go a long way. I anticipate we're going to be asking for more.
Yes.
At this time, I'd like to turn it over to Mr. Baroe with Charleston County School District.
Thanks, Chairman Summey. On behalf of our Board of Trustees and our Superintendent, Dr. Postlewaite, I do want to thank each of these leaders to my left and right. They've done a phenomenal job, along with their teams, in supporting our school district and protecting our students and faculty and preparing them for what's to come. I'd like to make 3 points on behalf of the school district that are of importance to the community. First is the preparation and pickup of educational materials. That is underway. Our teachers and our leaders have done a phenomenal job in preparing those packages for students to continue to learn after hours through this crisis. For parents that haven't picked those packages up yet, please contact your school to get the hours of operation between now and the end of the week. Second point I'd like to make is our meals program is up and running. Within less than 24 hours of being told we were going to close, we had our first meal put out. Yesterday, we have 15 sites. Yesterday, we added 4 more sites today, 2 at schools and 2 in the communities, and we expect to expand that as time goes on, reaching out into the community more to minimize the impact on our parents. We're serving a lunch and the following day's breakfast, so they're getting 2 meals at every pickup, and it's for any students that are 18 years and younger. Lastly, but not least, we're trying to make sure that those that have devices at home from the school district have the ability to access the internet. We're doing that in 2 ways. One is at each of our schools, we've expanded the internet accessibility outside the building. So parents can bring their students outside the school and get access with those mobile devices, those tablets. And we're also looking at putting vehicles on the road, hotspots, as you will, in the very near future, so that students in neighborhoods that are a significant distance away from their school have that access during the school day. That covers it from the school district. Again, I want to thank the leaders to my left and right for all the help they've given us.
Thank you, sir. At this time, I'll call on Sheriff Cannon. He got some remarks. Sheriff?
First off, we met the agencies, law enforcement agencies in Charleston County, the larger ones, met in the last couple of days. And it is absolutely crucial that law enforcement act and speak as one. To do otherwise creates confusion with our citizens. Now, the one area that I would like to quickly address is the detention center. A lot of concerns from folks there. The governor's office, the governor's emergency declaration said that visitation would not be allowed. We will continue to provide visitation. We have 36 booths at the detention center where individuals can come in and through video contact with the inmate and their loved ones have a visit. We're going to do that from 9 a.m. to 9 p.m. On the hour, and it will be allowed for 30 minutes of visitation, at which time, when the visitation is over, we will disinfect the booth in preparation for the next individual. At the Juvenile Detention Center, for the last several days, they have been able to make phone calls at no cost. We have also set up 3 visitation booths for the juveniles. Those will be at the main detention center, not at the juvenile detention center. They'll be at the main detention center with the other visitation. And folks wishing to speak to their juvenile loved one will have to go there, but they will have that visitation. In both instances, also, we will be able to provide home video visitation. So that should assure folks on that point. And finally, we have protocols in place for the detention center. We've done this in coordination with the state jail administrators association as well as national similar organizations. We have a protocol, and that includes providing personal protective equipment when necessary for those in the detention center. And finally, we have currently 8 beds, which includes 2
very special negative pressure beds that will accommodate individuals who have been screened, which our medical folks will do on a case-by-case basis based on history or contacts, those sorts of things, or symptoms. We can isolate those inmates. In addition, we're working to ensure that everybody we can get out of the detention center, we're doing so. CJCC in the last couple of years has been working, and as a result, the inmate population has diminished as we've sought alternative measures to incarceration. So there are not many of those folks left in the detention center, but we're looking to make sure everyone is looked at in terms of whether or not they can be released. We also, if need be, can open an additional 64-bed unit to accommodate folks who become symptomatic with the virus. So that should also assure some folks. Thank you.
Thanks, Sheriff. I'd also like to thank Colonel Adams. He's here today. He's made himself available for Joint Base Charleston to answer any questions that you might have, and I will at this time open the floor to questions. Yes, ma'am.
Hi, Ann Emerson, ABC News 4. I've got a couple of questions right off the bat. One is, why wasn't this emergency ordinance posted with the agenda under the Freedom of Information Act? We did not have access to this new ordinance that was just put in place before now. I'm being told that the clerk said that that was normal standard operating procedure, but from what I understand, that's going against the Freedom of Information Act. So
I'd have to refer you to our legal office. It is very similar to most of the ordinances we have passed in previous years in regards to hurricanes, and I know that our agenda was posted online as well, so those ordinances are always there. If you click on that agenda item online, it's there online.
after the fact, but not before
I
the fact.
couldn't speak to that, I don't
Okay.
know.
The second thing is, I wanted to find out if there's any coordinated effort based on the town of Mount Pleasant, city of Charleston, and North Charleston to go ahead and close bars and restaurants. Is there talk about that, and is there any coordinated effort on the county level to do this?
As you can see standing here, there's a coordinated effort on everything that we do. And that's not just in this case. That's been going on since 1989 in Hurricane Hugo. Mayor Riley and at time Chairman Summey, who's now Mayor Summey, put together a procedure with the Tri-County area. We follow those procedures pretty precisely. And as you can see, we coordinate everything. We have had requests, and we've been having conversations with each other and with the governor's office about those things, and those conversations are ongoing.
So it hasn't been decided, there's no...
If we have something to report, I'll report it.
Okay.
Yes,
and
ma'am.
my last question is for the Dorchester County
Yes.
Councilman. We understand that there was possibly someone exposed at the Giant Cement site in Carlyville yesterday. Do you know anything about an incident that DHEC is investigating a potential exposure? There was a contractor who became ill around employees. Do you know anything about
I
this?
have heard about 8 o'clock, I got a call to that effect. And I'm sure DHEC and everything's being done possible. John's a good company, a good partner in Dorchester County. I'm sure they're searching through it, and I think that we're doing everything possible to bring this to reality.
Okay, so when are we going to hear like what the situation is there?
As soon as I get the information, I'll be happy to share it with you. We are very busy, ma'am. I'm telling you, we are very busy.
Let me comment on your question, too, about the emergency declaration. I think it's important to recognize that this is a rapidly evolving situation. And so what we do and discuss here certainly is going to be addressed on the state and federal level and will impact this. As it turns out, this declaration, there were some aspects of that legal was working on right up to the time that the meeting was held. So that may have been a factor as well.
Let me add something to what your first question. We just came out of the meeting in the back room, and Chairman Summey said that we did get a correspondence from the governor. There was a lot of things discussed and what we may and may not do tomorrow or today, but we're going to wait until the president and the governor, what they're going to say, because we may have to backtrack. So, we're going to give them the first push
Yes.
to go along what we plan to do.
Yes, ma'am.
What will prompt the county from moving forward with some of these emergency ordinance conditions, like suspending collection of accommodations taxes, the plastic ban ordinance, and a curfew? What will prompt that?
As declarations from the state. If President Trump or Governor McMaster ask us to do certain things, we'll obviously accommodate their requests. That would be the first and foremost. Second of all, as conditions change in Charleston County, we will make those decisions as need be. So this is a fluid situation and rapidly changing, as you know, constantly changing, and so we will make those calls as we see fit. As I said during our council meeting, we will not act without consensus of our council. As you can also see in that emergency ordinance, we have the ability now to meet for information purposes telephonically, which is not something that is our normal set of circumstances, but we've asked the governor's office to help us, give us the ability to be able to meet and open those lines to the press as well if we need to meet telephonically. It's very hypocritical for us to try to continually meet in public and when we're asked our citizens not to meet in public. So we're doing what we can, how we can, and the best we can, and we will make those decisions as pragmatically as possible.
Chairman Summey,
Yes, ma'am.
Michael Higdon with Live 5 News.
Yes,
you mentioned
ma'am.
briefly in the county meeting prior to this one about the talks about curfew, and obviously you will take direction from the president and the governor, but if you could talk just what you are talking about with our local municipalities, of where are we in that aspect?
Right now, we are nowhere with that. That is not on the table right now. I can speak on behalf of all the mayors and the county and the sheriff. We don't see that as an issue right now. That is a placeholder, and those placeholders, you'll see a lot of those things in there are placeholders. If we need them, we can use them. Again, trying to keep our county councils and our city councils from having to continually meet. The president has asked us not to assemble in groups of more than 10. I got 5 fingers, I can count. We're more than 10 right now. To continually bring our councils together to do those things would be very hypocritical of us. So we have those things as placeholders if we need them. And that's not dissimilar than any hurricane or flooding event that we've had, at least in my 12 years on county council, certainly 4 years as chairman. Anytime we've had a declaration of an emergency situation, we have had that as a placeholder in case we need it. I will tell you, in the 6 times that we've had to declare a state of emergency in Charleston County, as my 4 years as chairman, we have never had to have a curfew. We don't want to infringe on folks' civil liberties. That is not what we're here to do. We're here to keep people safe. And we're going to do everything we can not to have to do that.
In regards to the homeless population, obviously they cannot self-quarantine in their own home. Are there extra precautions being taken in monitoring the homeless shelters in our area?
I'd have to defer to Mayor Tecklenburg on that.
The City of Charleston's homeless coordinator and emergency management held a kind of regional meeting on Friday among service providers to those experiencing homelessness. And certainly we got a little more work to do, but we identified a couple of key issues, and that is transport of those experiencing homelessness who might need to go get a test. So in fact, we have identified some vehicles where we'll be able to accomplish that. The next question logically is if a positive test were to occur, hasn't yet, where would that individual be quarantined? And working with the county, the City of Charleston and the county and our other partners are exploring all opportunities for having a small place where we'll be able to quarantine some folks.
Every citizen in this community matters, whether they are you, me, or homeless folks, no matter race, creed, nationality, religion, whatever, no matter their economic status. Every citizen in this community matters to us. I know 180 Place has the same marching orders that we do. If you think you got somebody with symptoms or who's been exposed, you go to MUSC. We are blessed to have the American University of South Carolina in our hometown. We are blessed to have them. And we have to have them as a resource. We're a lot better off than a lot of other folks. And so they are monitoring their folks. MUSC is helping make those calls. They're helping guide us. I can tell you CEO Cawley and President Dr. Cole have been in meetings with us individually and together to help guide us through these situations. And their expertise is invaluable in this time. So every citizen in this community matters. We're going to protect every citizen, and we're going to provide for their health, safety, and welfare.
Mr. Barrow, I have one question for you. You mentioned that there were 4 additional locations for food pickup that were added today, 2 at schools, 2 in the community. Do you know those off the top of your head?
So we've sent meals to Jane Edwards Elementary School, Baptist Hill Middle High School, and then we had 2 community pickup locations, one near Meminger Elementary and one near Sanders Clyde Elementary downtown.
And those 4, in addition to the 17 others, will continue?
Those 4, in addition to the 15 others, will continue, and we're looking at expanding as well.
Perfect.
If I can just remind folks to check ccsdschools.com for that information, too. Thank you.
Anyone else?
I do. Mayor Haney, I have a question for you. You've said that you would like grocery stores, to have senior-only hours.
Yes.
Is there any movement on that, at least in the town of Mount Pleasant?
Yes, I got a call, there is more movement, but I got a call from Publix today. They are in the process of doing that. It's a suggestion, it's not a requirement, but we all know that the threat to overwhelming our healthcare infrastructure is with those more vulnerable to this, because some young people can have it and not even have symptoms. And so if we can cut down on the community contact and community spread aspect of this, where you don't necessarily get it from another person but from a surface, that would be great. And so I saw that a national chain was doing that, and I thought it'd be a good idea to do in Mount Pleasant. They will be announcing it on their own. They're not doing this through the town. We just said unleash your ingenuity and have at it, and the community outpouring has been great.
Right. Is there anything that is helping seniors who live on their own, anything the town can do to address those?
Well, yes, we have senior advocates, and they can contact the town with that. But again, we want to unleash the potential of our citizens to do the right thing, neighbor to neighbor, church to church, group to group.
Meals on Wheels.
Meals on Wheels as well. Thank you.
Do you have a word out to any of the community members who might be buying in excess more than they need?
We have in our emergency proclamation a prohibition against price gouging. We don't have anything in there telling you how many rolls of toilet paper you can buy, because that would be really hard to enforce. But we do have the moral influence to say there's no reason to hoard anything. There is no shortage of toilet paper. There is no reason to learn how to cook cauliflower and turn it into toilet paper. I mean, the national supply is out there, and it will be coming into Mount Pleasant.
Anyone else?
Yes.
Yes, ma'am.
Does the county have an accounting of how many ventilators you have available to you?
I would refer to MUSC. We don't have a county hospital. I'd refer them to MUSC, Trident, East Cooper, and Roper St. Francis.
Has the county been in contact, obviously, with the hospitals about
Absolutely.
how many tests that they've been able to get at this point?
I don't know that number for sure, but yes, I've been told in our Tri-County call, we do, our DHEC and our hospitals are on those calls, and they have said that they are well supplied for the amount of tests, and that they have no issues being able to test folks as far as the number of tests available. Anyone else? Thank you.
We'll do a translation for the Spanish.
Ingrid?
Buenas tardes. My name is Ingrid Guina. I work for CDC 911 Center. La información que voy a dar a continuación es para el condado de Charleston. El gobierno del condado de Charleston se encuentra en condición 2. La línea de información para residentes está abierta de lunes a viernes de 9 de la mañana a 5 de la tarde. Para preguntas relacionadas a las operaciones del gobierno del condado de Charleston y el coronavirus. El número para llamar es 843-746-3909. Repito, 843-746-3909 para español. El gobierno del condado de Charleston continuará operaciones normales como la recogida de reciclaje y sus centros de acopio. Se aconseja a usar las opciones de pago en línea en lo que es posible. Los operadores del 911 harán preguntas adicionales relacionadas con enfermedades o problemas respiratorios. Para el condado de Dorchester se encuentra relacionado en estado de emergencia debido al coronavirus o conocido como COVID-19 y la amenaza que representa para la vida, la salud y la seguridad de los residentes. Desde las 6 de la tarde del día de ayer, el Centro de Operaciones de Emergencia del Condado de Dorchester se encuentra en condición operativa número 2, en respuesta a la pandemia del coronavirus. El Centro de Operaciones de Emergencias estará abierto durante el horario normal, 8:30 de la mañana a 5 de la tarde. Y la Administración de Emergencias del Condado de Dorchester estará continuamente monitoreando la situación. Hasta el momento no hay casos confirmados de coronavirus en el Condado de Dorchester. Sin embargo, debido a la naturaleza de este virus, se aconseja a los ciudadanos mantener el distanciamiento social. La Administración de Emergencias del Condado de Dorchester está monitoreando de cerca el desarrollo de casos en todo el estado y continuará comunicándose con la Administración de Emergencias del estado y los funcionarios de salud pública a nivel local y estatal. El Condado de Dorchester está mejorando las medidas preventivas para mitigar la preparación del virus. Por lo tanto, los edificios de servicios del Condado de Dorchester están cerrados al público en general. Se aconseja a los residentes y las empresas acceder a los servicios del condado, realizar las transacciones comerciales con el condado usando la página www.dorchestercountysc.gov. Los tribunales del condado de Dorchester permanecen abiertos hasta el momento. En el sitio web que voy a dar a continuación se encuentran disponibles una lista completa de cierres, incluidas oficinas e instalaciones comunitarias, así que guarde este enlace, www.dorchester.county.sc.gov/COVID-19. Se pide a la comunidad que tengan paciencia y comprensión durante estos tiempos difíciles. Recuerden que juntos podemos superar esta emergencia. Gracias.
To address the emergency ordinance situation one more time, state law and Freedom of Information Act requires us to post the agenda. Because this was an emergency county council meeting, state law does not require us to post the actual ordinance. So that's the difference. And again, because things were fluid, things are happening real time, and we're getting new and updated information, it seems like on the hour out of the federal and state government, that's why that ordinance was not posted 24 hours before. But state law requires the agenda, not the ordinance. That's the difference. With that, thank you.
Thank y'all.